Okay, looks like we have some more participants. Can you please introduce yourself?
Hello. Hi, Dr. Stewie.
Okay, sorry guys, I've muted you all. We're having some technical difficulties, but let's get started. So first, maybe you guys all know each other. We have Dr. Landerer here. We have PA Alperin on the line. We have Faigy Weichselbaum. We have Ladja in the room. We have Beatrice Bleier. And we might have Berkovitz. And we have Dr. Krausz. Hi, Dr. Berkovitz. Nice to meet you. He's in the room now. So you may already know each other. Okay, you may have walked in a little bit late. Okay, we may already know each other, but I wanted to get to know each other some more. So if you don't mind, I would like to get started on something called icebreakers. And I would really like if you could take a moment to read these questions and go around and introduce yourself. So.
You are unmuted.
Having very bad background noise.
Yeah, what is that?
Okay. Want to go around the room and everybody introduce themselves a little bit? Okay, thank you. So, Dr. Krausz, can you start?
Yeah,
Sure. Hi. I'm Dr. Krausz. I'm the CMO at ODA. I think I know everybody. I've met everybody there. So let's move on.
Hey.
Are you able to see the screen?
What is
that squeaking?
Beatrice?
Yes?
I'm gonna hang up and call back. Because there's a lot of that, like background squeaking.
Yes. I don't know if it's your phone. We don't know whose phone it is.
Okay, let me hang up
and try to phone back in.
Okay.
She's on the line, but
they
don't.
You can hear her?
Malky Scholzen, are you here? Malky, we can't hear you.
Yes.
Welcome to Zoom. Enter your meeting ID followed by the pound or hash sign.
Okay. The next person would like to introduce themselves, Faigy, Malky, Dr. Shakui, whoever else is on the call.
Enter your participant ID
Sure.
followed by
Faigy Weichselbaum. I'm Dr. Shakui's registered nurse, and I've been at ODA for the last 6 years.
There are 5 participants in the meeting.
Unmute. Okay.
And then unmute one at a time.
And I'm going to unmute one at a time. So how do I? Okay, Faigy, can you please try to unmute yourself?
Malky?
Yes.
We don't hear you on the call, so you can participate this way.
Okay, I called you in there on my cell.
Okay. Fine.
Okay.
So you can hang up. You can hang up, and you can be on this call on my phone. Oh.
Beatrice, can you hear me?
Yes, I can hear you.
Okay, I think I'll talk through the computer rather than talking on the phone and see if that works.
Okay.
Okay, so Dr. Krausz, can you see the screen?
Can you hear me, Beatrice?
Yes, we can hear you.
Okay. All right. So I'm going to go around and introduce myself. Can everybody hear me? All right, my name is Juliana. I'm a project assistant at SPS department. I'm starting a new project, and I invited you guys here today because I wanted to start something called ODA's first super user work group for behavioral health. The reason you guys are here, there's a few people on the line: Dr. Landerer, PA Alperin, Faigy Weichselbaum. We have Ladja and Berkovitz. We have Beatrice, who is the head of the SPS department, and Dr. Krausz, the chief medical officer. And the reason why we're calling you here today is to introduce the new program to you. It's called Disrupt. It stands for Delivery System Reform Incentive Payment. Let me move this away. Okay. And I don't, first of all, I'm sorry to apologize. I don't know how to work this line thing, so let's just get started. Okay, so let's look at this line, this graph here. In 1966, there were 4 million Medicaid enrollees. Today, there are upwards of 68.9 million, okay? And this is a graph of how much money America is losing in healthcare costs. We're losing 6 million in emergency room visits. We're losing 22 billion in prescriptions. We're losing 140 billion a year in hospital admissions. So America is losing a lot of money, right? And
these are all avoidable, right? These are all avoidable healthcare costs. Yeah.
Mm-hmm. So America's losing a lot of money, and America's not happy. So they passed the Medicaid 1115 waiver amendment. And what this amendment does, it allows New York to implement the Medicaid Redesign Action Plan. And this MRT reform generates 17.1 billion in federal savings. And what this waiver allows me to do is take that 17.1 billion that they saved, take 8 billion of that money, and reinvest it into the system to address critical issues throughout the state, allow for comprehensive reform, promote community-level collaboration. But the overall goal, the bottom line, is to reduce avoidable hospital visits by 25% within 5 years. So this is a 5-year program worth about $8 billion called DSRIP. For the next 5 years, we're already past DSRIP year 0. Year 0 was the planning phase. And right now, we're currently in DSRIP year 1, noted by DY1. It starts in April 1st, 2015, ends March 31st, 2016. And it's going to go on until 2020. The good news, if you guys have heard of what PCMH is another incentive program that we're a part of. And the good news is that DSRIP is about 80% PCMH. And currently, we are PCMH, almost certified for the third year.
We are PCMH 2011 level 3 certified, and we are soon going to be 2014 level 3 certified. So we've done 80% of the work. But I think, Juliana, you've noticed a very critical difference between the two projects.
Yeah, the biggest difference between PCMH and DSRIP is that PCMH focuses on the provider, okay, making sure the providers are doing well, whereas DSRIP really focuses on the patient, making sure the patient is doing well in terms of the healthcare setting. Okay. And moving on, ODA is not a safety net provider. A safety net provider is a hospital who takes care of patients who might be in poverty, who might be in Medicaid, who takes emergency room visits. So we're not a safety net provider. So what we did was we joined a PPS. PPS is a performing provider system. There are 42 PPSs in New York. Okay. We ended up joining Lutheran Medical Center called Brooklyn Bridges PPS. So we're with them right now. The Brooklyn Bridges PPS has 189 partners. We're part of this PPS. There are 9 FQHCs, 32 nursing homes, 68 social service agencies. But the bottom line is this PPS is responsible for about 100,000 lives across Brooklyn. ODA alone is responsible for 50,000 lives. So we're a big partner in this PPS. Okay. So let's get into the nitty-gritty now. What does DSRIP mean for us? There are 9 clinical projects that this PPS is a part of, and ODA is going to be a part of too. Don't worry, eventually we're going to get down to like how this affects you guys, okay? So the 9 project starts like this. The first one is create integrated delivery system. And then the second one is ED care triage for at-risk population. Some of these we're not going to do because ODA is just, we don't take care of emergency room visits. So these 2 projects, ED visits and observation unit, we will not be doing. But we can do development of community-based navigation systems. And these are some of the requirements. We might have to implement EHR, which we already have. We have to work on our care center, care management, referral management.
And we're kind of going to be like Lutheran, which calls itself the group, it's called Brooklyn Bridges. Somehow they're going to develop some community-based navigation services where some calls will be routed through them, referral services will go through them. They don't know yet what it looks like. We don't know what it looks like yet, but there's kind of, the idea is that there's one place for everybody to reach out to get the referrals or help or navigation services that they need. We don't know yet what that looks like. The first project is just the platform of how information will be transferred between, you know, we're constantly getting requests already now for reports, and Juliana's going to talk about that a little further, different reports that they need and how, and the idea of that is how is that care going to be integrated and how is that information going to be passed through all the different providers.
Right. What a very important point that Beatrice pointed out is that the very first one is very important because it requires an HIE. And HIE stands for Health Information Exchange. This is how we're communicating with other hospitals. This is how we find out if one of our patients has been accidentally admitted into the ER. How do our doctors, Dr. Berlin, Mayor Shikui, are going to find out when one of their patients ends up in an ER?
So if there are any providers on the call, you should have taken your training. If not, Arlene will be coming to you to take your training, and then you can actually access data for patients that were hospitalized in different parts, in different hospitals, you know, not associated with ODA. You'll be able to get that information, and of course, if you have any questions, just let us know, because that's going to be an important part of what we do here, managing the care of patients, and part of that is knowing when they've been admitted to hospitals or not.
Well, if you guys have any questions, just to explain here, HealthFix is our HIE. We're part of something called HealthFix, which is how we communicate with some of the biggest hospitals if one of our patients ends up in the ER, or if one of our patients were incarcerated. Okay. Then the providers get an email.
They will be getting, they'll soon be getting, it's a project that we're putting in place right now.
Yeah. Okay, now we have 3 clinical improvement projects. This is where some of you might be able to jump in a little more. The first one is integrate primary care and behavioral health services. One of the biggest projects is to improve our behavioral health services and meet some guidelines. And we'll go into that a little bit more. Then we also have there's a diabetes management project, and we have an asthma home-based self-management program. Continuing on, we have tobacco cessation and early access to retention HIV care. Now, these 2 projects we don't really do. We're kind of doing tobacco cessation, but we don't really have a large HIV population, so we don't really do these. So out of 9 projects, we're only taking about half of them. But where you guys are going to jump in, and this is the behavioral health supergroup, is the very first project, is to integrate primary care and behavioral health services. Okay. Now, this does have the word incentive program in it. It is the delivery system incentive. So the funds will be based on achieving project milestones, which makes sense because Medicaid is moving toward a value-based system around 2020. Okay. Now that we all know what project we're part of and that we're part of behavioral health, our best year was in 2012 when 82% of our patients were screened for depression.
Right. And we use the PHQs, right? The PHQ2 and PHQ9, right? Maria knows. So we're using the PHQ2 and PHQ9. That's what we're referring to when we talk about the depression screening. And this year we're at about 60%. Yeah. Yeah,
this year we're not doing so great at 60%. I mean, our personal goal is to reach 95%, and it doesn't look good for ODA, it doesn't look good for the PPS, it doesn't look good for New York State. So that's why you guys are here. Let's push these numbers up. In addition, district is also looking at introducing something called warm transfers. So what a warm transfer is walking the patient from the primary care provider into the behavioral health office. What's good about ODA, and we're ahead of the curve here, is that we already have Park Avenue. Park Avenue is attached, I mean, it's literally right across the hallway. This is something a lot of FQHCs, a lot of places do not have, so we're a little ahead of the curve here. So that's what they're going to be introducing, a warm transfer.
And in further meetings, we're going to be discussing the actual implementation of this. But the idea is that if a provider sees a patient that, you know, failed the PHQ-2 and PHQ-9, looks like is in need of help, instead of sending them home and telling them to make an appointment, there would be some sort of system in place where they can actually somehow get to a behavioral health provider, even if just for a couple of minutes, even if just to the receptionist to actually make that follow-up appointment, but that there should be some connection and follow-up. And I think, Dr. Krausz, we've spoken about this several times, is that even when we do the screenings, there's kind of like a disconnect. Some providers are following up with referrals, some are not, but we don't really have a solid system in place where everybody knows exactly what to do. And, you know, this has been something that we've discussed internally for the last year that I've been here, and now the district is bringing up as an issue as something that they'd like us to deal with. So in future meetings, you know, we'll be discussing where district is going with this, and then how we're actually going to be implementing this at ODA.
Can you hear me, Beatrice?
Yes, we can hear you.
Okay, yeah, I guess what I would want to basically say is that the purpose of the group, I think the group should kind of view themselves as advisors to ODA because they really know how things work on a day-to-day basis. And once we understand what the goal is, you know, kind of to improve behavioral health delivery to our patients, improve the screening process so that screening is actually more meaningful, and then really to be able to, the most important part really is to be able to identify those patients that are in need of services and to reach out to them. So I think the goal of the group really should try to be to think about what the process, the actual workflows need to be to facilitate identifying those patients and facilitate a system to, once those patients are identified, to reach out to them to get them into care.
Turmeric is more of an anti-inflammatory.
Yeah, thank you, Dr. Krausz, for bringing that up. And that's, you know, that's going to be the purpose of this work group. We'll be meeting once a month, and Juliana will be sending out an agenda. We'll be sending out the purpose of each meeting. This meeting was an introductory meeting. You know, we're looking at what are your workflows, you know, at the site that you work at. You work at Park, you work at Quality, you work at Hayward. What's your workflow? What are you doing? And what do we need to do to reach these goals? You know, what do we need to do to bring our number of screening up from 60% to 95%? How do we make sure that the patients that are identified are actually receiving the care they need? So absolutely, the reason why we have such a broad array of providers and different employees at ODA is to be able to give that input and really understand what we're doing now and what we want to do in the future. Absolutely. Thank you, Dr. Krausz.
Do we have any more questions? Everybody has been unmuted. Okay, so to sum up the meeting, we're looking to improve 3 things. We're looking to improve our screening numbers, we're looking to improve our follow-up protocol, and we're looking to introduce something called warm transfers. Okay.
It's gone, it's finished. Nothing, just to
All right. So this concludes the end of the meeting. I would like to reiterate that we, at the moment, we do have an implementation plan for behavioral health, but I'm working with, hi, Naomi.
Hello, hello. I can't
I'm
do
Maureen
more.
Alperin.
I felt much better that I wasn't
You
feeling
can actually sit. You want to be here.
Hi. Okay.
Okay,
Yeah.
so basically, it's going to affect the top and the bottom.
Yes. Yes.
So I'm willing to, that's why I came.
Yes.
Instead of being on the computer.
Yeah. Absolutely, absolutely. And again, what exactly it's going to look like, or what exactly they'll need from us, we're not sure yet, but the idea will be, okay.
By the way, this was 20 minutes late, because I came
The whole,
10:05.
the fox
We didn't want you to work
the
too hard
fox in
today.
here doesn't work. It's good for Mitzvah. Down Mitzvah.
Cops don't work in all of Williamsburg, even Davin Memphis at midnight. Even Shackers
Things
to
are changing
whenever.
with the system or with ECW, sorry, we came late.
Okay, so Juliana, you can start from the beginning again.
Okay, I'm not going to start from the beginning, but I'll sum everything
I'll
up.
tell you that if we have a meeting at 10 o'clock, you have to block our schedule from like 9:15.
Okay, duly noted. I'll block you for the entire night.
And I think that's the last one here, trying to play.
Patients walked in 4 minutes before I was supposed to come in. So that's
Oh,
why-
and I
but
only
yeah,
didn't want him to be the last to come in, so she was
Okay.
so kind and waited with him.
Yeah.
I don't know why my computer didn't keep singing me. Reminder.
Okay, so to summarize what you guys missed, you guys walked in around the end of the presentation. We had a little technical.
Already finished?
We kind of,
Yeah, you know what, you wanna just finish up and let everyone else go and then we'll start again?
Yeah, sure.
We can do
Okay.
that.
So.
That's a good idea.
Okay, so we okay,
Yeah, you know, I mean, we basically concluded the meeting. The next public hearing for Juliana is in a month, we'll meet again. By then, we'll have met with the asthma work group from Brooklyn Bridges. We'll bring you back information in terms of what they want from us, what they need from us. We'll ask you to prepare something for the next meeting. We'll go around, whether it is, what your workflow is, what you feel can be done. Juliana will collect that information, and that's what the next meeting will look like. Thank you, everybody, for your participation. I appreciate your time. And we will be talking to Naomi and Dr. and Pierre Alperin, who just walked in now. And thank you very much, everybody, for your participation. If you have any questions, please jump in now. Otherwise, you can feel free to email Juliana or me at any time.
Yeah, Beatrice?
Yes?
It's not so much of a question, but I kind of things would, I hear you clearly, and I heard Juliana clearly, but there was kind of some talking going on in the background. Didn't quite follow. Who just kind of walked in and what?
Naomi and Pierre Alperin just walked in. So we do want to let them in. They are part of this work group, so we did want to let them in on what's happening, but it's not necessary for everybody to stay on the call for that.
Okay. All right.
Okay.
Then I will get off the call for then.
Yeah, but if anybody has any questions, please jump in now. Otherwise, there's always opportunity to follow up with an email later on, and Juliana will be following up after this meeting, and we'll be giving you information in regards to preparation for the next one. And thank you so much for your participation.
Okay. Thank you.
Okay, thank you, everybody.
Yeah.